Hello and welcome. My name is Ravina Barrett. I'm a senior lecturer at the University of Brighton, and today I'm going to be talking to you about my recent publication with BJUI Compass. The title of my paper is Gonadorelin Adherence in Prostate Cancer, a time series analysis of England's national prescriptions during the COVID-19 pandemic, covering a period beginning in January 2019 to October 2020. So this is a paper in collaboration with Mr. Robert Barrett, Dr. Kalyan Dhar, who is a gynecological oncologist working at Swansea Bay University, as well as Professor Brian Birch working at Southampton University Hospital NHS Trust. The objective of our study was to examine the effect of the pandemic on gonadorelin analog prescriptions for community patients in England. We included all data from primary care patients who had relevant prescriptions dispensed within that time interval. We present descriptive statistics and statistics around our time series analysis within the paper. A quick snapshot of that is basically that we found over a 22-month period with 15 months in the pre-pandemic period, followed by 7 months in the period after the onset of the pandemic, we find that there are statistically significant downward trends. Gonadorelin, leuprolin, and triptorelin were the medicines that we studied, and we find that after the pandemic's onset, a statistically significant downward trend for gonadorelin with a p-value of 0.017, leuprolin with a p-value of 0.014 are observed, and that because these are major constituents of the model, we interpret that the overall data are showing a significant downtrend in this whole category of gonadorelin medication. Aside from linearity, so looking at the linearity before and after, which is what we found, we also looked for a step change, and we noted that for leuprolin there was a jump, an increase in prescription items with a similar effect, close to being statistically significant for gonadorelin. Remember, gonadorelin is the largest constituent within our model. The actual cost of medicines showed minimal variation, pretty much tracking the quantities being issued and used. The regional data does show some variation, and we believe that artifacts within that analysis represents the potentially regional lockdowns and releases within that data set. But overall, that was not statistically significant in the post-pandemic onset period compared to the pre-pandemic period. In all cases, though, October 2020 figures month on month, year on year, are lower than before the pandemic, or even in October 2019. This novel work reports basically the impact of the global pandemic on prescription volumes for prostate cancer medicines, and we generate an early warning signal that maybe these patients are not getting their right medication. Within the discussion section, we consider implications to public health, the strengths and limitations of our analysis, as well as conclusion. And in conclusion, we basically find that there is a declining prostate cancer prescription medicines being dispensed, and this may be happening for a variety of reasons that we do not fully understand, but there is emerging evidence suggesting a variety of barriers to care emerging as a consequence of suspension of face-to-face therapy. And we recommend that extra effort should be now taken by clinicians and healthcare professionals to recall their patients and check their health. And that obligation really should be taken quite seriously before potentially any kind of litigation cases are considered by patient bodies. So thank you very much for your attention. I hope you enjoyed this presentation. Thank you. Bye.